It's now time for the big story. And we're going to be talking with Dr. Alfred Dawes, the PNP Spokesman on health, who is demanding accountability from Prime Minister Andrew Holness, as well as Health Minister Dr. Christopher Tufton, following the deaths of at least 24 babies at the Victoria Jubilee Hospital in Kingston. Dr. Dawes joins me right now. Good morning and welcome, Dr. Dawes. How are you today?
Hi, good morning, and good morning to all the listeners. I'm good.
All right. Doc, let me start by asking you to elaborate on the failures that you saw within the system that might have resulted in the deaths of these 24 babies.
Well, first, let me just issue again my condolences to the grieved parents and families. The issues that I saw, point to a general lack of commitment towards service delivery or expansion of service and ensuring that we have good service delivery, but rather the government's focus on mega projects. Now, if you look at the Victoria Jubilee Hospital nursery, we know that it has been overcrowded for years. PAHO came and they did a report. I recommended that we address staffing issues, we address infection control practices, as well as the general space shortage that they noticed. And this was triggered after I think it was 9 or 12 babies died in 2022. So we know that there has been an issue. We know it has been highlighted by external auditors. What has been done since then? The staff have been complaining about the general lack of coverage, other staff, as well as poor working conditions, not having the proper tools. And we're talking about basic tools such as a portable X-ray that is needed to diagnose conditions that can be a matter of life and death within hours or days in these premature babies who are very delicate. You don't have an X-ray unit. You have to remove the babies sometimes while they're not very stable over next door to KPH and pump the corridors, and that requires the movement of nurses leaving the unit further understaffed. So we know that there's been a lot of resignations over last year. There's probably about 9 or 12. I'm not sure.
Health
fed up.
Health personnel.
Health personnel.
Mm-hmm.
Yeah. And these are not people who are just migrating. These are people who are resigning and they're still in Jamaica. So we know that the unit has an issue with retaining staff, and a lot of that has to do with the high levels of stress. We also know that there have been incidences where there have been similarly high numbers of deaths on the unit. December last year and September last year, over 20 deaths were recorded. This was hidden, of course, from public knowledge. So these are deep systemic flaws that plague the VJH as well as other hospitals. So it's a matter of inevitability that you will have something like this happening, whether or not you have an outbreak. The other thing that is a very grave concern is that the ministry's constant reaction to this and any other crisis is to downplay it and deflect blame, and to not own up to the fact that there are systemic challenges within the public health sector that warrant wholesale reform. And that is what we're seeing here again playing out.
Mm-hmm. So you believe that this is a reflection of a wider series of set of problems that the hospital is facing?
This is just another symptom of a cancer that's affecting the public healthcare system. It's as simple as that.
Mm-hmm. What about the investigations into these deaths? What can you tell us as to how those are progressing?
This is just a farce. This is just to appease the public. Outside of 5 babies dying, there should be an investigation. If it's 10 babies dying, nothing was triggered. 15 babies died, nothing was triggered. 20 babies died, Nothing was triggered. 24 babies died, and the only time that investigation was started was when it became public. So it is a knee-jerk reaction, part of crisis management, why you're seeing this investigation. And if we know that the intent of this investigation is to do damage control, then we know that the findings are going to be geared towards damage control. So we don't expect to find legitimate concerns being raised. Already we hear that it is not an issue with infection, and that is being bandied about as if it is something good. But if you have 24 babies dying, a baby a day dying, and it's not because of an infection, something is going wrong. The other thing that I see this preliminary investigation talking about is that you have over half of the babies being premature and about 40%, 60% being of low birth rate. It means that nearly half of those babies were born at full term and they had a normal birth weight. About 40% had a normal birth weight. So the excuse of being delicate babies and premature babies does not hold up. Plus, you do have a special care nursery, a neonatal ICU specifically built for these fragile babies, as they term them. So it's not a cause of death. It is actually, it's like saying somebody is dying in the ICU because they're sick. It's not because they're sick. They're in the ICU because they're sick. Something is happening in that ICU that is causing an inordinate number of deaths. So already the preliminary findings are something to be rejected wholesalely. We hear talk about as well them investigating whether or not the mothers had antenatal care, and that is the next stage of the investigation. That is utter rubbish. It is callous, insensitive, and you just cannot blame or seek to shift blame on the mothers. So you should not be investigating that. Something is happening there. Do not blame the grieving mothers.
So at whose feet do you place the blame for what happened? Is it the administration at the hospital? Is it the leadership within the Ministry of Health? Where do you see the blame falling?
This is a policy failure because they know the issues that have been arising. The resignation letters have stated the grosses. We have the PAHO report. We have we have knowledge of what is needed to fix the issue. If there's an overcrowding problem, we have a hospital nearby, Bustamante Hospital, which is supposed to be the premier children's hospital in the Caribbean. They have no neonatal ICU at all. So you're going to have overcrowding issue. You're going to have shortage of staff. What have you been doing from a governmental level, from a ministerial level, to address these issues? The blame lays squarely at the feet of the minister and his boss, the prime minister, because they know the issues and they never did anything at all to address them.
Over what period of time, for clarity, over what period of time did these deaths take place?
So, let us frame this thing properly. The furor about the dead baby scandal under the last administration that triggered the resignation of the Minister of Health, Fenton Ferguson. Those 18 babies died across 2 hospitals over the span of 3 months. You're talking about 24 babies dying in less than a month in a single hospital. So this is far more significant than what happened in 2015. And this is not the result of an outbreak, as we are being told. So therefore, it means that there are deep systemic challenges affecting that unit.
One death is too many, and especially if it's because of, the wrong approach to health care. And there are similarities with that 2015 comparison with what is happening now. What lessons are being learned from all of this, Dr. Dawes?
The only lesson that is clearly learned is that the Prime Minister is a hypocrite. because he was very strident in his condemnation of the Minister of Health, saying that the blame squarely lay on his feet because of challenges with the adherence to infection control principles and etc., etc. So if you have a systemic failure, then the Prime Minister should fire his Minister of Health. Now that he is Prime Minister, his silence is deafening.
So you have been very critical of the government, but what steps, maybe immediate steps, would you, as opposition spokesman, recommend to the government to take to restore public trust in our maternity and neonatal care at this hospital and all hospitals across the island?
Well, the blueprint is already there. They need equipment. You need immediately a portable X-ray so that the staff can diagnose early any issues affecting the respiratory system as well as the gastrointestinal system without moving these unstable children. And then they can initiate care at an earlier stage where the risk of death is less. You need staffing right now. We do have specialist nurses that can be brought in externally. It's just now, after 9 years, we're looking at recruiting overseas. There are other equipment that can be brought in immediately. There's some other, immediately you can get some treatment options like parenteral nutrition being sourced and properly administered. Bringing neonatologists from, we do have other neonatologists on the island, bring them in, find out what's going on, get the clinical team, the technical staff to do a proper audit to see what can be done to this, rather than somebody coming from the Ministry of Health with the sole intent of appeasing the public and downplaying what's taking place there. Create a farce of an audit for release. So we need to be serious and not look at this from a PR perspective, but actually look and see what exactly happened. Look at every single condition in these babies where there are late diagnoses because of a lack of equipment and lack of availability of resources. Is the situation where we could not continue, or we didn't have the proper treatment, where the delays in getting definitive treatment again. This could be due to a number of reasons. Each case is an individual tragedy, and we have to look at every single misstep, any systemic failure, breakdown, etc., that led to the death of that baby. And that is how we're going to solve that issue. But the staff need proper equipment, and we do need to, at the same time, hasten the construction of the neonatal ICU at the Bustamante Hospital for Children. So when you have a surge in admissions, they naturally would overflow to the Bustamante Hospital. The other thing that we're not looking at is that when the neonatal ICU and special care nurseries institutions are full, then babies in Type B and Type C hospitals are basically sentenced to death because they cannot be transferred for further care at VJH or Bustamante. So the other thing we have to really look at is the number of neonatal deaths across the island, because we just don't have the resources to treat them there, nor do we have the space to treat them at Victoria Jubilee Hospital. And this is why the neonatal death rate has gone up. It is higher than it was 20 years ago. So rather than trending down, we're actually trending up. And this is coming from the Ministry of Health statistics that was presented by the Minister of Health last year.
It's a traumatic experience for the mother and for the families who have these situations facing them. We definitely would like to add our voice to concern and also of empathy. And I want to thank you, Dr. Dawes, for coming on and expressing your thoughts this morning on the issue. Thanks much and have a good day.
Always a pleasure. You too.
All the best.